Greetings and welcome everyone to another episode on Oral Pathology Tuesdays. And today we have a dentistry special. Finally, at the heart, we're all dentists, and sometimes we go back to dentistry basically to bring you content that would be of interest to everybody. That includes, of course, all of us diagnosticians, but also includes anyone who has an interest in dentistry itself. So, okay, that was my short checkup every time. And today's topic is very interesting. We are talking about ethnodentistry. Basically, we are all from a rich background of a number of traditional herbal medicines. And we would like to be able to use these because, of course, they are natural. There's a promise that or a feeling that they would not be as harmful as the chemical content that we create and that is made, but then again they need to be researched and they need to be validated again as per today's techniques and today's way of uh, ensuring that things are done the right way and they have the right effect. So for that we need to do research, and today's topic is exactly about that. Of course, also before we go on today, or rather before the end, sorry, not before we go on, we will finish the lecture first. But before the end, there is going to be an announcement, a lot more details about the open mic competition. So please stay tuned right till the end. And if you find it difficult to catch us here or would like to hear it again, also it will be there at 6:30 IST on Instagram. That will be, in fact, our first live on Instagram. And I do hope that you will join us there. And yes, that was about the open mic. And at the same time, let me just say about today's presentation. Let me, of course, bring our guest in. Welcome, Dr. Sharada.
Good afternoon, ma'am. Hello, viewers.
Hi, good afternoon. So today, Dr. Sharda is going to be talking to us about ethnodentistry. She's a professor at the Srihar Dental College, and basically, she has been working on this for a long time. She has a specific interest on this, and when she was talking to me about it, also, she sounded very, very interested, and the presentation will be very interesting. So, with this short beginning, let's just go on, listen to the lecture, and come back, and then we will, of course, have our regular discussion. Do remember to increase the playback quality on your phones. If you're watching on a phone, increase it as much as you can so that ensures that you see the pictures and the text very clearly. Okay, let's go to the lecture and come back.
A very good afternoon to one and all. At the outset, I would like to thank Dr. Mandana and her team for giving me this opportunity to talk to you all about a novel topic on ethnodentistry, which is going to be a new horizon in the field of research. Before we delve into the topic, we need to understand how complex the biological system is and the importance of interdisciplinary approach. We would not be able to continue with the research just by ourselves. We need to take the help of, say, a biotechnologist, a genetic person, a bioinformatic person, and a pharmacy person to conduct a herbal research, especially because we are pretty new to the topic of herbal science. So we need to take the help of these people in order to understand the topic better. So, with this, I would like to emphasize an urgent need to study the plants and to expand our horizons for budding dentists. And with this as an aim, I would like to lay an overview on the rich reservoir of the medicinal plants which are available in India and how do we go about carrying out such herbal researches. Now, phytotherapy in India has always been there since times immemorial, and most of us are aware of and Charaka Samhita. And even in those ancient texts, it has been mentioned that every plant, every seed is very, very important for its medical and medicinal purposes. And India is such a reservoir, a rich reservoir of many such medicinal plants. So, what is this ethnomedicine? It is, to define it very broadly, the usage of plants by us humans as medicines, and it requires a very highly diversified approach, because to do a drug discovery, we need to observe, we need to describe what is going on, we need to experiment, we need to screen the drug, the herb, for all possible biological or medicinal properties which are present within such indigenous herbs. Now, if we look into the traditional medicine, we are aware of many such traditional medicines, say the Ayurveda, the Unani, we have the homeopathy, we have Siddha medicine, and not just in India, we have it even abroad. We have the Islamic medicine, the traditional Korean, the Japanese, Chinese medicine. But the core discipline within this herbalism is what is known as the ethnomedicine or the ethnobotany. Now, let me put into your perspective about a few facts at the global level. Now, such research is very important for the pharmaceutical company in order to produce modern drugs which are very indigenous and which are very easily available. The WHO feels that more than 60% of the population uses such herbal medicines for their primary health care. And no, why do the WHO people feel that? Is because 85% of the Japanese people, and even if you look closer into our India, people, two-thirds of the population use such Ayurvedic medicines. And this is not just in our country, even in the UK and in the US. In the recent years, there is been a big shift to the usage of such Ayurvedic herbal products. Now, with the advent of allopathic systems, the usage of herbal medicines seem to have lost its importance. But and therefore, there is an urgent need to study the medicinal plants. In fact, the WHO has sort of made an inventory of the existence of nearly 20,000 plant species, which have got such medicinal properties, and nearly 250 of them have been put into use. They are in vogue, and most of these drugs have been used or adapted by the western medicines, and they are being used for treating the diseases. Now, which are those? We have the foxglove or the digitalis, which is used, which is where we get the digoxin. We have morphine from the opium. We have cinchona, from which we get the quinine. We have ephedrine, which is obtained from ephedra, and all these are used in English medicine. We have belladonna, which is used as an anticholinergic drug. An interesting fact about belladonna is belladonna literally translates to pretty woman, and it has been used as for dilating pupils by the Greeks. So all these have been adapted into the English medicine to serve their medicinal properties in treating various diseases. We have ashwagandha or the vithania, which has been used again as an anticholinergic drug. We have the meadow saffron, which is used in the treatment of gout and Mediterranean fever and pericarditis and atrial fibrillation. We have the Vinca rosea, and most of us are aware how the Vinca alkaloids are used as a chemotherapeutic drug in the treatment of cancer. We have Ravolfia, which is used as an antipsychotic drug. We have the Vinca alkaloids, minor alkaloids, which are used as a peripheral vasodilator. We have curare, from which we can produce the drug for skeletal muscle relaxation. So there are so many such plants which have been adopted into the Western allopathic medicine. And what should be our goal is to isolate, to characterize many such biologically active compounds which are present within the plants. And we need to ensure that they are properly studied so that we will get to know about their structures, and these compounds can be used as lead structures which can further be taken into medicinal usage by the pharmaceutical industry. Now, I'm sure most of us have seen this photograph in various hospitals, and this is how the medicine was practiced in ancient India. This is how the ancient people were practicing the ancient form of medicine and surgery. Now, all of us are aware of the chemotherapeutic drugs and their cytotoxic effects which they have on the patients when they are used. Of course, they are life saving, but they do come with a lot of adverse effects. So, that cannot be discredited. But of course, it needs to be used when it comes, as a do or die situation. But when we delve into our past, we can explore uh, that the nature has come up, the nature has given us a lot of plants which are available, which can be tapped for their medicinal properties. So when you look into the preventive part of cancer, and as an anti-cancer drug, we have the host of these drugs which are more very very familiar to us. We have the neem, pineapple, tulsi, tomatoes, and cabbages. So what is tulsi? It's a holy basil. It contains a lot of metabolites, and they have been used for treatment of respiratory diseases and skin diseases, certain eye diseases, and as an antibacterial agent. And there are studies which say that they provide significant radioprotective action, tumor protective action. It's an excellent antioxidant, so therefore it can be used as an anti-cancer drug. We have neem, which has got a lot of medicinal properties, and it is used as an antimicrobial agent. Now there are studies which show that it can inhibit cell proliferation. Of course, this has not been studied in detail as far as oral cancer is concerned, and that is a study which is ongoing in our department. We are using an oral cancer cell line to study the effects of neem. We have the anasi param, which we call in Tamil, or the pineapple, or the ananas. Now, they have been proven to reduce the local tumor growth and also metastasis. See, imagine these are fruits which we use in our everyday diet, and they have got such kind of anti-cancer activity. We have tomato, and tomato has been, trust me, it has been studied extensively, and clinical trials have also been happened as far as the oral potentially malignant disorder is concerned. And people have found out that when tomato is used as a in the form of a diet, as a diet form, the people who have such kinds of potentially malignant disorders like leukoplakia, their when you look into it histopathologically, after they start having tomatoes, it has shown improvement. So the anti-neoplastic activity has been shown in breast cancer, and we have also done it in using our oral cancer cell lines, and it has shown promising results. Cabbage is another vegetable which we use, and it has been used for rheumatism and for ulcers. It's got an anti-inflammatory property, and it is known to induce apoptosis and cell cycle arrest of the cancer cells. So it has been studied for anti-cancer activity too. And we are all aware of Taxol, which has been used extensively in breast cancer, and this has also been derived from plants. Now, radiation induced mucositis is something the cancer patients can suffer from, and we have the marigold and tulsi again coming to the rescue. So, marigold, which is Calendula officinalis, has got an excellent antiviral, anti-genotoxic property, and studies have proven that there is a significant reduction in the mucositis which has been induced by radiation when it has been used as a mouthwash. And it has been proven that it can play a part in treatment of such radiation induced mucositis. We have the holy basil again, which has got not only an anti-cancer activity, but it has also got an adjunct property of having radioprotective activity, and it has been proven by an animal study. We have menthol, which contains a lot of metabolites like eugenol and rosmarinic acid, and it is being used in irritable bowel syndrome. For muscle pain, we must have seen a lot of balms which contain these menthol, and it can relieve pain. And studies have proven that it provides protection against radiation induced mucositis. Now, let us look into a few plants which have got antifungal activity. One thing which we need to, look into is our pepper and cranberry. Now, pepper is something which is widely seen in South India, and we use it in our everyday diet. It's used as a spice. Now, it has been known to relieve constipation, insomnia, oral abscesses, and studies have proven that it can prevent the adhesion of candidal hyphae onto the mucosal surface. Now, this is the reason why it has got an excellent excellent antifungal activity. Cranberry, now cranberry is being advertised these days. The juice has been asked to be taken in the treatment of the urinary tract infections. Now, they have proven that these cranberries can also prevent the adhesion of candidal hyphae, and it has also got an excellent anti-cancer activity. So, in nature, when you look into it, it has got treatment for everything. When we have recurrent after stomatitis, a lot of such medicinal plants are available. One thing is aloe vera, and most of us know the skin effects of aloe vera. So this was studied for recurrent after stomatitis, and it has been found that it brings down the pain which is associated with the after stomatitis. The size of that ulcer has also been brought down. We have licorice, which is mulethi, the common mulethi, and it has been found to contain a lot of metabolites, and it has got an antiviral property and an antimicrobial property, a hepatoprotective property, and studies have proven that it is effective in reducing the pain and the redness which is associated with the recurrent after stomatitis. We have the common myrtle, which has been used in the management of ulcers and wounds, and this has been studied for the usage in our aphthous ulcer, and statistical reduction in the ulcer size, the pain severity, the erythema associated with it has all been showcased. Now, when we look into dental caries, now or normally what do? We are going to do an endodontic therapy or a restorative therapy, and we can apply a fluoride to prevent dental caries. Imagine soon we are going to have a situation where we will use plants to prevent and for treatment of dental caries. So what is it? We have carica papaya, which is your papaya leaf. Now these days this is being spoken of so much for the usage in dengue fevers. Now, again, there are studies which have shown that they contain strong alkaloids and polyphenols and flavonoids, which have got extensive antimicrobial property against the bacterial strains which cause dental caries, that is your streptococcus mutans and streptococcus mitis. Therefore, it has got an anti-cariogenic activity. In fact, we have done a study in our department, which was an ICMR funded PhD study, in which they have proven that it has got an excellent antimicrobial property and it has got an excellent anti-cancer activity. The sweet basil, the Oxymum basilicum. Here, it contains a lot of antioxidant and antimicrobial property. It is effective against the pathogens which cause dental caries. And again, another ICMR funded PhD study which was done in our department has spoken vastly about the anti-fibrotic property of sweet basil. We have neem. Like I told you, it has got an excellent antimicrobial property, and it can be used even against the microbes which are causing dental caries. So a lot of studies have been done even in this area. Now when we start thinking along the lines of doing herbal research, we need to do a lot of phylogenetics surveys. That is, we need to look into the plants which are which are possibly having such effects. We need to do an ecological survey to check out where are such plants available. Now, see, we cannot go, we can, of course, yeah, you can try to look into some plant which is grown somewhere in some particular part of the world. You can do it, but will you be able to market it? Will you be able to source it? That is something which you need to think about before you delve into the research topic. Ethnobotanical surveys, that is, who are the people who are using this? We have a lot of such traditional medicines used by people who are living in areas close by the when you ask them, they can come up with folklore tales telling that how this can be used for particular wounds and all that. Yeah, they get very interesting. So all these surveys needs to be done before you get into it, and when you do this, you of course you need a lot of help from the people who have studied this as their major topic. That is, I'm talking in terms of a pharmacognostic person. So how do we go about doing this study? We need to collect the plant material. So you need to think about where to go, when to go, how to collect. Now, a pharmacognosy person will be able to help us do this. And once we get it, we need the help of a botanist to sort of authenticate. Yes, we know that we have collected it, but when you need to publish that data, You need a scientific report for that. So you need to do an authentication of that plant which you're going to study in detail. And then you can use that plant to check into the microscopic study. You can study the leaf, the stamen, or whichever part that you are interested in deriving that particular active metabolite from. You can do a regular microscopic study, like how we do our tissues. You can do a similar study. Then we get into the next part of the study, where we need to prepare the extracts. So when we are preparing extracts, we need to collect the leaves, we need to wash them. Now before you do all this, you need to weigh them. So you are taking about 3 kg of it. Once you wash it, it would have reduced by a few grams, so that you need to document it. And then you need to shade dry it. You can put it inside a room on a filter paper. It should not be dried in the external atmosphere just like that, because when you're going to put it into direct sunlight, then the chance of the metabolite vanishing away sooner is very very possible. You need to use a mortar and pestle, and you need to macerate it. Once it dries off, it will crackle when you crush the leaf or the part that you have dried. It has to crackle. You need to use a mortar and pestle. You can use a regular mixer grinder, but the heat can result in the loss of such secondary metabolites. And then you can put it into a choice of your solvent. Again, a pharmacognosy person will help us, because whether you need to use an alcohol, or you need to use water, or you need to use a mixture of these two, or a hexane, it will all be told or decided by them, because they will know what are all the metabolites which are possibly available within this particular plant that you're talking. Then you need to collect the extract, you need to put it into a desiccator, allow it to, the moisture to dry, and then you need to preserve the extract. Now every step that you do, you need to document it, so that when you are publishing the data, you are aware of all this. How's the color of it, how's the final extract, how's the taste of it, how's the smell of it. All this needs to be documented meticulously. Then we can get into the next part of the in vitro study, that is the phytochemical analysis, to check for various substances which are present in it. This requires a set of biochemical analysis. And then we can do a lot of antioxidant studies, where you have a lot of kits which are available. And of course, a biochemistry person will be able to help us do this. So you need to do a phytochemical analysis, make a marking, or document everything which is present there. And then once we finish these tests, you can then go into the extraction part of the compound. Again, we need the help of a pharmacy person here. You can either use a thin layer chromatography, a high performance liquid chromatography, or a gas chromatography and a mass spectroscopy. This is based on the type of material again that you have. So all this pharmacy person will be able to help us out. Then we get into the various studies. You can do an antimicrobial activity. We will require the help of a microbiological person here, because you can get those strains, use your test compound, and check how the activity is. We have done it for a few of our studies which have done their been done in our department, and it has been documented in journal publications, as well as in various conferences in India. And then we can go into the anti-cancer activity. A lot of assays are available. See, when you look into anti-cancer activity, you can check out how the proliferation activity is, how the apoptotic activity is, what kind of apoptosis takes place, how is the growth of the cell, how is the morphological appearance of the cell once you treat it with the test compound that you have isolated. You can check out how it is behaving with the cell cycle analysis by using flow cytometry. You can use a reverse transcriptase RT-PCR analysis to check which are the genes which are being targeted in this kind of an anti-cancer activity. You can even isolate that particular protein. You can specifically get those anti-apoptotic and pro-apoptotic markers. You can estimate their level. What is the quantification of the anti-cancer activity which is happening, the quality of the anti-cancer activity which is happening. Say for example, we have the acridine orange ethidium bromide staining, which is a qualitative analysis. It will show you which are all the apoptotic cells and which are all the cells which are necrotic. Then we have a Western blot analysis, which is a quantification of the anti-cancer activity. Cell cycle analysis is again a quantitative analysis which will tell you where in which cell cycle is this anti-cancer activity going, and what is it causing to the cancer cell. once we do that, we can also check the anti-fibrotic activity, because see, oral submucosal fibrosis and a lot of fibrosis which is happening in the oral cavity has been associated with oral cancer too. So if you can prevent the fibrotic activity, then you can in a way prevent oral cancer also. So you can do a lot of studies related to it, and you can check for the fibrotic markers. You can do a staining to check out how the the anti-fibrotic activity is happening. And you can also do a wound healing assay. Usually the scratch assay model is used for wound healing. So you can do a variety of analysis to check how the activity of the plant is. And we can also, once we finish all this, we can also patent it. So for that, for doing this, you need the help of a patent officer or a patent lawyer who can tell you how rare is your study and how you can patent it. If you are unable to patent it, at least you can make a copyright out of it as to how the methodology that you are doing, that can be copyrighted. So all these are novel things which needs to be documented, and it can add a lot of value to your research. A lot of study has been happening on curcumin, and it has been patented. And now moringa, this is in vogue. I mean, everybody is speaking about it. People are thronging to get moringa leaves, moringa curry powder, and all that, because of its excellent properties, medicinal properties. In fact, we have a very famous study, a clinical study, a randomized clinical trial, which has been done by Dr. Hazare sir and his team, where they have established the efficacy of curcumin in the treatment of oral submucous fibrosis. So it is not necessary that you should just do an in vitro study. Once you finish with an in vitro study, you can go on to do an animal study, and then you can take it as a clinical trial. So for all this, of course, a lot of money is going to be involved. So ICMR has got a lot of research funding for this. You have the Ayush medicine, which is very good in giving grants for such herbal products. And then you have a lot of agencies, like you have the SERB grants. So all these grants need to be utilized by we researchers, and this can add on a lot of value to our research. And once we do this, the ICMR and at a global level, they feel that India is a very, very preferred destination as far as herbal research is concerned. Now, why do they feel that? Because the attractive index is quite high, and India has got a lot of lab practices which are very, very good, very authentic. And in fact, the WHO has come up with a traditional medicine strategy, in which they feel that traditional medicine values have to be tapped, because such medicinal systems are very close to homes, accessible to a large population, very affordable because they are indigenously available, and they are also culturally acceptable, and people can start using them without much fuss about it. So the WHO has gone out and out to support such traditional medicine researchers. So dentists and clinicians like us must evolve into translational biologists and as biomarker scientists, because this is a fertile soil. And as budding researchers in the field of pharmacy or herbal research, we can bring about a lot of revolution in treating such communicable as well as non-communicable diseases, because we are living in a country where there are a lot of ethnic groups, and there are people who are open to using such traditional medicines. And we also have a lot of researchers who want to toil hard to come up with the new researchers as far as herbal medicine, and thereby adapting it into the allopathic medicine is possible. Because once you scientifically establish this and go about doing your animal research, you can make it into a formulation and then bring it into a clinical trial. Thereby it can be just absorbed into the system of allopathy. So we need to look beyond horizons, get out of our shell, integrate with the pharmaceutical company, with biotechnologists, so that we can deliver a personalized treatment. So in summary, the tools which are necessary to overcome the whens and ifs is all only in our hands. Such molecular revolution, if it needs to take place, it is all possible. It is well within our hands. These are some of my references. So, as dentists or clinicians, one must concomitantly pursue research and contribute at large to discovery of drugs, because this can help the common people at large, because our earth contains a lot of such medicinal plants and they need to be tapped for such potential. I would like to thank Dr. Mandana ma'am and her team once again for giving me this opportunity to interact with you all. And my heartfelt thanks to Dr. Malati madam, professor in our department, who has been instrumental in triggering this kind of ethno dentistry related research in me, and for guiding me throughout my PhD study and as well as this presentation. I would also like to thank my dean and professor and head and my department in helping me pursue this field of research. Thank you. And I would also like to thank the audience once again. Thank you, one and all.
Thank you. That was a very insightful and interesting lecture. And I do know that since I told you to keep it short, it was short. But
Thank
maybe
you,
we can have
ma'am.
a more detailed one later.
Sure,
Yes.
definitely.
Yes, it may interest you that I was running a poll simultaneously and the question was, is the use of traditional medicine common in your region? So we have 83% who have said yes and 17% who have said no.
That's interesting, ma'am. No wonder the WHO has come up with a strategy.
Yes.
So 2023, 2024 is going to be a year where they're going to tap so much of these herbs into
Yes,
medicine.
I think, COVID had a number of impacts, and among those was that we need to also be depending or moving on towards some of the original or the ethnic
Way
medicines
of
that we
treating.
have.
Yes, ma'am.
Yes. And as you listed in that very interesting slides, there are so many parts of the world. Now, we don't know about so many of them actually.
Yes, ma'am.
We think of,
Actually, there is much
Indian
more.
traditional
There is
medicine.
much more. But like you said, owing to
Yeah,
the time, and I couldn't put much. But every part of a plant, every part of the fruit has got its own potential. It needs to be looked into
exactly.
carefully.
Yes, only thing I think we in the allopathy dentists, we are allopathic kind of group of
Yes,
people.
yes.
So we have this slight, what should I say, slight doubt or about the traditional medicines because of course they are not tested in the same way that medicines today are tested.
And that's the reason why we need to practice this now. Early,
Hello,
so
did I
now,
lose you? I lost you
are
for
you
a
able to hear me?
second. Now I can hear
Am
you.
I
Yeah,
audible now? Yes, ma'am.
yeah.
Now, see, earlier in Ayurveda, if you see that the entire crude extract was being used, whereas in this kind of study, we are going to look into it in vitro on cell lines. We will then translate it onto the animals and then take it onto a clinical trial. And here we will also be extracting. I hope I'm audible, ma'am.
Yes, you are. You are.
So we'll be extracting that particular, phytochemical of choice. And again, see, the basic thing in an allopathic medicine is we have a weight based medicine, so that we know what is the amount of drug which goes in. Now, when you're using a crude extract, that might not be possible. But if we are going to do some tests like this, we will be able to, mimic the allopathic way, but you're using an indigenous compound. You're not producing it. Completely synthetic. It could be more of a semi-synthetic way. So you get the best of both worlds.
True. So we have a comment here once. Let me bring this. Dr. Shruti says, amazing talk, ma'am. Guess there is some pride associated with the use of indigenous herbs. Thanks for tapping into them. Yes, I guess if you are from a region such as India, there would be some pride associated with it, yes. And she has written, I remember how heartbroken I was when I knew the US had patented turmeric for its wound healing property, when my great grandmothers had been using it for centuries without an
And Moringa is
attractive
moving
education,
towards that.
Dina. Yes, yes, that is true. There's a lot of things, a lot of Indian products. In fact, I would say this probably happens to a lot of the third world countries, or of course, we are not really third world anymore, but at that developmental stage where other advanced nations have patented things which were really ours. So, I mean, I don't know how else to say it, how to say it diplomatically. This is a fact. You cannot overcome facts. It's like basmati rice. I mean,
Yes,
how
ma'am.
much more Indian can you get? Uh, you know,
Thankfully, that has been
maybe
GI tagged, ma'am.
that's been
GI tagged. It's got a GI tag.
GI tag, yes. So, yes, we have one more comment from her. Very insightful, Sharda ma'am. Guess this talk is going to fuel the advent of some novel research topic among postgrads, which has been quite monotonous for at least half a decade now. Yes, I can understand that. Right. And okay. So, everybody put in your questions and your comments. And while you are waiting and in the intervening time, of course, if you liked the lecture, please hit like. And also, if you are still not subscribed to the channel, please do subscribe. And let's see what else we got. Right. So, our vote has changed now to 88% who say yes and 12% who say no.
So
So,
as more people come in,
yeah, more
sorry.
people come in. No, it's okay. Some people sort of hop in a little late, so that happens. What you was talking about was very interesting about the fact that the concentration based,
Yes, ma'am.
because duplicating the concentration required to bring in an effect, what I would say a short term, a medicinal effect. See, because a lot of things have effects, but it's long term you know but if you
Yes,
want to use it as a medicine, we often need it to act faster,
yes, ma'am.
but then to take the quantities that would lead to an effect in the short while. If you attempt, for example, even something like turmeric, if you actually attempt to take the quantity of turmeric that would bring on a medicinal effect, it would almost be poisonous, because
Exactly.
there are also other components. So it is also important that we start thinking the process. The research also helps us in that process of separating the components which
Yes, ma'am.
should not be taken.
Yeah, you can sort of extract all the compounds separately. And before we proceed with the research, the first thing that we will be using is an MTT assay, which will sort of check for the cell toxicity. So we will
Okay.
know if that extract is going to be toxic. If so, is it toxic to only the cancer cells, or are the normal cells also going to get affected? So all this can be checked, ma'am. Only after doing all this, we can go into an animal study, and only after everything gets sort
Sorry.
of documented, we can take it into a clinical trial. And like you were saying, ma'am, if you're going to use it in the form of a turmeric, say for cooking, you cannot add a lot of grams. It has to be done
Yeah.
in minor amounts, because it's not just the curcumin which is present, but a host of other compounds which are present. But if you're going to tap into the drug form, you will be able to extract only curcumin, and it might be enough if we get it in a few micrograms or a few
Exactly.
milligrams, and you can make a tablet out of it, and it's more of a pure format.
Yes, exactly.
It
That
needs it.
whole process needs to be is what we would be
Absolutely.
essentially working on a lot, I think.
Yes, ma'am. Once we finish with these tests, we'll have to get into a pharmaceutical, there is a pharmaceutics, which is a branch of pharmacy. So if we go there, we can look into how the drug could be manufactured, which form is the best, which will help in, extraction or absorption of that. You need to study the pharmacokinetics, the dynamics part. You can do a network pharmacology kind of a thing. So which are all going to, go and attack which part. So that is how the,
Going to be
yeah.
the stages of the whole thing.
Yes, ma'am.
Yes. Now, tell me, when you're doing a study, if you want a grant, for example,
Yes, ma'am.
would the existing literature, the Vedas or wherever we can get, depending on which part of the world one is, uh, do they accept that as a background proof? Because we normally have to have something that we are building it on. Is any
Uh,
part of that just to start the study?
Ma'am, that is something which I, sort of feel a little downhearted, you could say, because when you're going to apply for any of these ICMR or any of these funds, they look into what is the kind of research that we have already done on it. So we should have published one or two papers on it. So at least the initial part of the study, say the antioxidant part or the anti cancer, just the MTT part of the essay, it has to be done as a part of a dissertational study, or as a postgraduate study, or as a self-funded study. Once we have a couple of papers, I feel even the granting agencies, they feel that yes, this person could be a competent, and he or she is very serious about working on this.
Right.
That's my take on it.
Okay. Now you're thinking about the person. I was thinking about the substance,
No.
because a lot of
Oh,
it is
all right.
already quoted. When you're thinking about the fact that you want to say study XYZ, and the reason you are thinking of studying it is because wherever in the world you are, traditional medicine has cited it as being useful. So, in which case, wherever you are thinking of getting a grant for that study, will they accept that as a
They will,
part
ma'am,
of the proof?
provided there is some novelty to it. If somebody else has worked on the same cell lines or on the same along those, the lines of that research, what you're planning to do, if there's no novelty to it, you might probably not get it. But if you say that there are certain, scriptures which say that this could be useful, and I want to look into it, yes, some of these agencies might be convinced. They
Yes,
can
of
give you a
course,
grant.
novelty and the what I would say, the quality of the work or the planning has to be, I guess, with anything that you're planning. But yeah, I was just thinking of what I mean. The WHO says that they're going to play a lot of importance and
Yes, ma'am.
give it emphasis. But how really serious are they about giving it emphasis? Was what I was trying to find
They've
out.
come up with that picture that I had shown is a whole book, a strategy planning book, ma'am. So they are trying to keep that strategy in India at a place in Gujarat. So they're going to start a sort of a collaborating center there, so that all these studies could probably get into translational biology and come out as medicines. In fact, recently the PMO's office has come out last year, in fact, in the year 2022, that every PhD thesis which is coming out from the university, it needs to come out with one page. I mean, after the references part and all, as a future insight. What are the things which are possible, which needs to be studied, and the future perspective of the study. So if it has got a better, what should I say, something which is translatable, then that could be taken up by the government. I'm assuming that all this, when it gets into the Shodh Ganga and other places, definitely some scientist is going to do the screening and probably, you know, keep working on that, so that at least at the end of the day we get something useful.
That is true. Professor Hiller said the UWC, that's his university in Cape Town, has an active phytomedicine research interest. That's
It's
very
very
interesting.
interesting.
I would assume that Africa also will have a lot of traditional medicine.
Yes, ma'am. Yes,
I mean, they
yes.
are extremely old civilizations, so yes, they would. And so we have gone through our questions. Dr. Shelley also is with us. Hi, Shelley. And Samadan Raheja is with us. Hello. Okay. So, right, I think we do not have any more questions. So, that's fine. Anything else? Now, let's finish with your certificate and then come back with any other comments that you have. Yes, thank you so much.
Thank you, ma'am. Thank you for the opportunity to interact, and it was very kind of you to have invited me.
It's
Thank you
always
so
fun
much.
to have new topics and, broaden our horizons and see what else is happening literally beyond our noses or beyond our microscopes in this case.
Yes,
Yes,
definitely.
at least for us, yes. And
Yes.
although we do have now oral medicine colleagues also, but overall, a little beyond what we do each
On
day.
an everyday
Yes,
basis.
yes. So, okay. Oh, our poll has shifted now to 90% yes and 10% no. Okay. Right. So I think there are no more questions or no more comments. I think everyone is going to just chew on that and see what they can do with it. And maybe the next time we have a talk, we will have more questions. Yes.
So,
Okay. So now I have promised everybody that I will talk about the open mic. So let me do that. I will just go to this and will you be staying with us till the end of that, or
ma'am,
what's your timing looking like? When exactly? I know you have to
generally
go.
in
Yes,
about 15 minutes, there'll be, the college goes for a
college
shutdown.
closing. Now, okay. So let's finish with your, closing comment. What is the short takeaway you want everyone to have with this?
I would say that people need to read more literature which is pertaining to such plants and the herbs which are available in our country. And the more we start reading about them, we need to start documenting if they have all undergone an in vitro study or has it gone into an in vivo study. Only then we'll be able to translate it. So the first part would be is to understand that such kind of potential is available, is for us to tap. It is there in the mother earth. We need to spend a little time to understand what are all the compounds which are present. And I think in that way, translational biology should not be very far off from us.
Yes, true. Okay, let me say thank you to you, and we hope to see you again soon.
Thank you,
Um,
ma'am. Thank you so
please stay
much.
on as long as you can, but
Sure,
nonetheless, otherwise, we shall see you. Yes. So let me
sure.
come to sharing about this the open mic. We had an open mic about 2 years back that was just to give everybody a chance to come out and speak. So this time we are having a little modified version. It is actually a contest. The last time it wasn't really a contest. This time it's a contest. And two people, it's going to be conducted on 2 different days as live sessions. So each session will have one winner. And those winners will be invited guest speakers among our panel of guest speakers for the International Oral Diseases Case Presentation Conference 24, which has been scheduled for the 3rd to 5th of May. So, what more can I tell you about it? First and foremost, something everyone has been asking me is who can participate. So it is early to mid career. We are keeping that a little loose definition, but I would say anything less than 15 years. And students, I am sorry, but this time we are not including you. This is for people who have finished studying at least. So anybody who is in academics, researchers, or professionals, and of course in any related dental and medical field. Remember, at the end, the idea is to win and to speak to us in the case presentation conference. It's an oral diseases case presentation conference. So, obviously, that's going to be your target audience. So, you should be someone from a field or have something to say that would interest that audience. That is about that. Of course, when I said no students, that does not include PhD students. Yes, PhD is not really a student. Okay. So, what about the topics? Now, to keep the playing field a little even, we have chosen some topics. The first is impact of digital technologies on oral pathology. And the next one is oral microbiome and its role in systemic health. The other one is the role of nutrition in oral health and disease prevention. And then the IARC states that there is no safe limit for alcohol consumption. So we want to hear your take on that. And I think I will go and change that first one. It should not be just oral pathology, it should be oral and maxillofacial diagnostics because, yes. So please, that will change by this evening, yes. And how will it work? We are going to have you first submitting a form, that's your entry. which you will submit along with an abstract. Then from those abstracts, we will shortlist a number who will perform live, and then that live performance is going to be checked by the audience. So they are going to be the one deciding who wins. It's audience vote. And right, there are, like I said, two events. I'm sorry. Okay, the live event one, the first one, the submission deadline is on the 3rd of February, which is why I thought I should remind you all about it today. And the announcements of the shortlisted candidates will be on 10th of February. The event itself is on the 1st of March and it is at 6:30 IST. The idea for this is to involve more people from other parts of the world that cannot come to our 3 o'clock events. And the winners will be announced on the 2nd of March. The second event, the deadline is on the 11th. The announcement of the candidates is on the 18th. The live event itself, or the contest itself, is on the 12th, and it is at 3 o'clock, 1500 IST, and that is actually our Tuesday. Okay, that's on one of the Tuesdays. And the winner will be announced on the 13th. Right. So there is a registration fee. For the international, it is $8. For India, it is INR 475. Everybody who has become a member of our YouTube channel on the enthusiast, expert, or the maestro levels will get a discount. And yes, I know some of you may be thinking, why a registration fees? Well, as you know, we are everything that goes on is being totally funded by us, and the us does not have a big institution behind it. It is me. So which is why we need funds to run everything that basically costs, and also we use the same funds sometimes as this is of course not going to be anything extra, but otherwise we basically collect funds also to run our other activities. And also, I think it will ensure that more people will take it very seriously when they are actually giving in their names. At the same, so to be able to do this, you need to go to our website, and of course, then the winners will come in free. Will be our guest, as all the guest speakers are for the conference. So we hope that will make up for it. This is again just a reminder of the same thing, but it is also giving you the details of the time zones. Now, uh, if your area is not in these time zones, please just go to the website and there's a time converter and you can see it. So this is where I felt that it would be somewhere between 7 in the morning till 7 in the evening, and I till 8 in the evening, and I hope that it will be convenient for people to attend in these areas. But of course, not every major city is listed. This is just to give you an idea of the zones. And then this is the second event, and again the times that go with it. With that, I have come to the end of this. Is there anything else? No, that's it. Okay. To the end of this, what I do want, another thing, of course, any questions you have on the open mic, you can please share them. And in the meanwhile, let me also ask you something else. This is where I would normally tell you next week's program. So, next week we have a choice of two recorded lectures. One is on Alzheimer's and the patient in practice of dentistry, but it is more about the disease. Uh, and the other one is about oral sarcoidosis. So, which one do you want me to share with you? Maybe you can put it in the comments. And let me see. Yes, we are. Also, in case you know anyone, or in case you missed this, or you want to have a more direct interaction about the open mic, for the first time, we are going live on Instagram this evening in about 3 hours. I mean, 6:30 IST. It's the first time we are going live on Instagram, and I thought I'd just share with everybody what's happening there. So you can join us there too. And are we getting a comment about any of this? Okay. So you all can also leave your comments afterwards, af- after the event. I mean, after the live stream, You can then type in the comments and tell me whether you want the sarcoidosis or you want Alzheimer's. But do make it a point to tell me by tomorrow, because then by tomorrow I have to decide and finalize which one it will be. Right. So, of course, that also means that next week is not a live session. Take, take a note of that. And right. So, okay. So, let's see. We had a comment that I did not share. Let me share that. Dr. Neetu saying, very informative session, ma'am. Thanks. Yes, I will say thanks on behalf of both of us. Okay. Righto. I think we are done. And our poll also has not changed anymore. So I have nothing to report on that ground. Cool. So I will see you all. Yes, I will probably see you all next week, even if it's a live, even if it's a recorded one. I will play it for you. But stay in the know, of course, on all our channels, and put in your comment as to which one you want. And see you. Thank you for being with us as always. See you next time.